remedied at this point, considering the prior two votes. But maybe someone can see something that I can't. I see this as a benefit that we provide to our teachers. That's what we've been talking about all night, is a benefit we're providing to our teachers. The teachers are the consumers of that benefit, and we as the school board are the financiers of that benefit. And the way I look at things, the consumers were not complaining, they were happy, but as the people financing that plan, we were looking to save money. And I don't fault anybody with anything I've said so far, because I think everyone's position is legitimate. The concern that I have is, it seems to me that we've taken the benefit the consumers were happy with, and then we've undercut it without giving the people providing it an opportunity to compete. So what I'd like to see, and again, I don't know if this is possible at this point in the process, but the board, or at least representatives of the board, has stood up here and said that, you could have saved this money by just asking us to meet it, match it, or deduct from the plan. So to me, it seems that that is the best resolution, is to somehow include them in the process, this competitive process, to provide that benefit at the best possible price for us as the people who are financing it. And I don't see that that occurred, and I'm not sure if it can occur at this point, and I'm hoping someone's going to push the button and tell me that it can be done, because I think that's the most fair way to look at it. Anybody? I mean, I really think it's unfair that I mean, it's kind of like, you go to buy a car and you walk in the showroom and the guy says, I want, $10,000 for this Cadillac, and then you go to 3 other dealerships and they say, well, I'll do it for $9,900, I'll do it for $9,800, but then you don't go back to the original guy who might be willing to give it to you for $8,900. So I think the process is flawed, and I think it's only fair that we open it back up to allow the people who served us without a complaint to compete for it. Thank you.
Thank you, Mr. Morgan. Mr. Floyd?
Yes. Mr. Morgan, I would like to thank you, I guess, for that insight. That's something I didn't think about. And maybe that the Health and Welfare Board should meet as soon as possible and get back to Dr. Messer between now and Friday or within the next week. And if you could, like Mr. Delesdernier is saying, it's all about saving the money. And if you could be at $151,000 instead of $158,663, we should go with it. That's based on what they're saying about saving money. And if, in fact, that this will not go into effect until October 1, you got some time on the clock. And let me just tell you this. We had a little special meeting, Labor Day. We met again, and to save money, like you're saying, is worth it. Once that figure, make it public so I'll know, and maybe we'll need to call a special meeting to go with the best deal for the teachers, since they're satisfied with the product. So I would recommend to the Health and Welfare Board, see if in fact with your reserves of over $2 million that you could provide these savings. And also, let me just tell you this again, it's the answer to Mr. Delesdernier, and I intend to always answer him, is dignity and respect for teachers. And it was you, the JFT members, that provided us with these outstanding improved test scores. He's acting like the board did it, but the teachers did it. You did it, JFT members. And since you represent more than the majority of teachers, so there's no way he could say it wasn't any JFT member that wasn't part of high expectation in reaching them. And the board didn't do it, the teachers did. Thank you very much.
Thank you, Mr. Floyd. Dr. Licciardi?
Thank you, Mr. Jacobs. Mr. Fulton, is there a reason that you went through this bid process rather than an RFP?
We were trying to be honest about it, keep it, low key. It is a professional service, so we didn't have to necessarily do it in an RFP. In such a thing, there's a lot of providers out there. I mean, tons of them. So by doing it in the manner I did, I was somewhat limiting it to, your top companies in the United States.
I mean, I can see that you need to expedite the process, but it just seems like it was real involved, and I don't know how much more involved an RFP would have been.
Yes.
And
thank you.
And I just think that that's where the board needs to be with an RFP. Thank you.
Thank you, Dr. Licciardi. Mr. St. Pierre? Okay. Mr. Dale?
Thank you, Mr. Jacobs. Mr. Fulton, was cost or savings to the system the most important issue?
No, not at all. The most important issue was that we exactly mirrored and followed the benefits that were being provided by the Health and Welfare Fund.
Why were
It
you,
was not, in the beginning, it looked like we would be paying more. And it wasn't until the last few days in the bid process that I received bids that actually had this savings.
was the system ready to pay more to get the comparable benefits?
I understood, yes, but I wasn't sure of that.
Why did you have to hurry with the process?
We had our open enrollment for this process starting September 25th.